Hello and welcome to another very special Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and today I'm joined by Lauren Chapnick, who is one of our nurse practitioners with MedStar Georgetown Transplant Institute. We hope to also be joined in a couple minutes by Shahzia Lakhani, who is also one of our nurse practitioners with MGTI. And millions of Americans visit with nurse practitioners every day, as they often serve as the patient's principal healthcare provider, offering quality, accurate care, and so much more. NPs are medical professionals who diagnose illness, develop and manage treatment plans, as well as prescribe medications. Today, we'll be discussing the role of a nurse practitioner, specifically how they support our transplant patients here at MGTI. We have a lot to cover, so stay tuned to hear more. Please share this broadcast with your friends. Give us a like to let us know you're watching. And if you have any questions for our experts, you can leave them in the comments below and we will answer them during our broadcast. So Lauren, thank you for being here today. Before we get started, could you tell us a little bit about yourself and your experience working as an NP?
Sure. Hi, everyone. My name is Lauren Chapnick. I am an acute care nurse practitioner, and I have been an NP for almost 10 years now. I went to school as a nurse first at Villanova University and then worked as a surgical ICU nurse for a couple of years before I went back to get my acute care NP degree, which I got at University of Pennsylvania. And then I got my first job as a nurse practitioner, as an inpatient nurse practitioner for liver transplant and transplant hepatology at Mayo Clinic in Rochester, Minnesota. Did wind up doing some outpatient clinic there as well, was there for 4 years and then came here. And I've been here at Georgetown Transplant Institute for a little bit over 5 years now. And here I've done lots of different roles, but kind of all either in transplant or sort of around transplant.
Okay, great. Thank you. Well, once again, thanks for joining us. Let's get into the questions now. So first off, I touched on this a little bit in the introduction, but could you describe a little bit more about the overall role of a nurse practitioner?
Absolutely. So a nurse practitioner here is actually really interesting because you can be a nurse practitioner in lots of different areas. So here we have inpatient nurse practitioners, which I was before I transferred to the outpatient setting. Shahzia, who hopefully will be joining us, is still on the inpatient team. And the role really is we're the ones, seeing you, assessing you. Usually we are sort of more of the continuity of the care because we see you most often. Whereas like sometimes the surgeons or doctors, especially if you're inpatient, they rotate every week. So we're kind of those people who see you, can help diagnose you, manage everything like we talked about before, write medications, and we really look at you as a whole and we really try to take a holistic approach. So if you need physical therapy, if you need mental health treatment, if you need, ostomy bags, we kind of look at everything and, we can treat you, and we work really well in multidisciplinary teams here. So it's kind of a great experience to be an NP because you get to kind of do a little bit of everything and still really manage patients.
Yeah, that's exactly what I was going to say. It sounds like y'all do a little bit of everything. And so you mentioned schooling a little bit. How much schooling do you have to complete before becoming an NP? And can you kind of talk about the path that you take to get there?
Absolutely. So to be an NP, you do have to go to nursing school first.
Yeah.
So I went more the traditional nursing school route where I went to college and I did 4 years of university, got my BSN, which is your nursing degree. There are lots of different undergrad nursing programs nowadays, like accelerated and all these other things, but you do have to be a nurse first. Once you graduate, then some people work as a nurse for a while. Some people actually just go right in for their advanced degree. And so basically I went to University of Penn and I decided to do full-time. So I didn't work and I went full-time to kind of just get through it quicker. And I got my master's as an acute care nurse practitioner in about 2 years, which was going like full-time, lots of classes through the summers to kind of just get to the point where I could just start being an NP. But there are also a lot of options there too, where you can go part-time. A lot of people work and they'll take 1 or 2 classes at a time so that they kind of have a balance. So it's really interesting. There's also a lot of tracks as an NP that you can specialize in. So Shahzia and I are both acute care adult NPs. You can also specialize in adult primary care, You
Okay.
can do pediatrics, neonatal, family medicine, where you can kind of have the range from, babies or children all the way through adult. And then you can also do psychiatry or psychiatric NP. So
Okay.
lots of different options.
Yeah. Great. Well, thank you for explaining that to us. And hi, Shahzia. Thanks for joining. We're glad to have you.
Hi, thanks, Sarah.
Yeah. So before we get back into the questions, could you, Shahzia, give us a little introduction and tell us about your experience working as an NP?
Yeah, thanks. So my name is Shahzia. I'm a nurse practitioner, acute care, adult gerontology prepared nurse practitioner. I started back as a nurse. I got my bachelor's in nursing and worked for a little over 5 years as a nurse at the bedside, working actually in transplant at a hospital in Baltimore called Johns Hopkins. And then I went to NP school to get my master's and be a master's prepared nurse practitioner. And I specialized in acute care, which means I can take care of patients in the hospital setting, specifically adults up to caring for patients. Sometimes we're able to do that in the outpatient setting as well, as Lauren does. And now I've been here with MedStar Georgetown Transplant Institute for a little over 3 years, and I've been practicing as an NP for a little over 5 years.
Great, thank you. Well, once again, thanks for joining us. So getting back into the questions, can NPs practice in all states and in all types of medical practice? I know, Lauren, you kind of talked about that a little bit, but could you, go into that a little bit more?
Yeah, I'll let Shahzia take that since I answered the first few. So that.
Okay.
Thank you, Lauren. So, nurse practitioners can be autonomous in some states. Other states require collaborative practice where you have to have a physician sign off on you seeing patients, and that you will routinely reach out to them for recommendations on a patient. And they do have to chart check a few charts a year to ensure that you're meeting the criteria for patient care in that particular state. And the laws are different in every state, but NPs provide like a valuable contribution to patient care and are able to formulate a plan with multidisciplinary team pretty autonomously, and physicians regularly will rely on the nurse practitioner to provide the care for patient independently.
Okay. And kind of going off that a little bit, I know this is a question that I have and probably a lot of other people have. What is the difference exactly between a nurse practitioner, a PA, and a MD?
Shahzia, do you want to start with that one?
Yeah, sure. So nurse practitioners have a nursing prepared background, nursing model, and have experience in providing holistic care at the bedside clinically. So they have a lot of clinical practice before they become a nurse practitioner and then continue on. You can be master's prepared or doctorate prepared. And PAs, as you probably saw with the last Facebook Live, offer a lot of the same collaborative care that nurse practitioners do. They do have a medical model, much like the physicians, and are everyone is really valuable part of the team. So NPs, as you saw with both Lauren and I, we practice clinically as registered nurses, and here at MedStar, we are trained to provide holistic care, and we work with a multidisciplinary team. So all of us really practice very similarly. On the inpatient side, the nurse practitioners, NPAs, we work with a team of almost 15 to 20, what we called advanced practice providers. And NPs and PAs work alongside each other, doing exactly the same roles and responsibilities, providing the same care, and just our training is a little bit different with our nursing model and medical model.
Okay, great. Thank you. We also have a question from one of our viewers. Michelle asked, what were the challenges of getting your first NP role? I don't know if you both wanted to give an answer to that. Lauren, if you wanted to start out.
Sure. That's a great question. I think I kind of got a little bit lucky. that University of Pennsylvania routinely is one of the top schools in the nation, and there are some places that hire NPs that specifically try to attract NPs from there. So actually, when I got my first job at Mayo Clinic, they actually came and did a presentation at University of Pennsylvania, and I kind of asked the HR rep afterwards, what kind of openings they had, and they happened to have one open in liver transplant. And I did, I helped with transplant as a CICU nurse. I knew I wanted to be in transplant. So I applied there. And I think I got that job probably within a month or two after applying and obviously like passing my boards. I did apply to some other positions here. And I will say some of them, would interview me and some of them didn't. Some of them did say like, we want our NPs to already have, some experience. So I think, it could be hit or miss, but.
Yeah.
Yeah, I think sometimes role transition can be a little bit hard because you're so used to, as a bedside nurse, relying on taking care of the patient in that you're physically providing the medications, doing medication administration. And I almost find that as a benefit, and maybe Lauren, you can relate, but it's like when you walk into a patient's room and you're pre-rounding, you're like, I think maybe this IV is probably best for, if I'm going to order potassium for them, or I'm going to order, I think about it. What is the nurse going to do today based on what, how is the nurse and the patient's day going to be today based on how I guide the patient's care? So if the patient's potassium is low, but also their magnesium and everything else is low, and I have to really consider how long is this infusion going to take? I have all that experience, and we joke about it all the time because having nursing experience almost is like a benefit, but also you're like thinking for someone else as well. You're like, okay, well, I know if this patient needs all of these infusions, it's probably going to take the entire day. So let me see if some of them can be oral, because you've been there before. You know what it's like to hook up 6 different IVs and the patient either has poor access or can't get an IV, or they have to go to procedure. So you know that the treatment that you're going to order might be delayed, and you have to really prioritize the care.
Yeah, so I would definitely say that like Shahzia, I feel like really hit that on the head. And when we were talking about sort of like what's the difference or what kind of benefits can you get when you see an NP, I definitely feel like our nursing background is one of the big benefits, because most of us have all done clinical practice. So you think about things differently. So when you put an order in, for a patient, sometimes the patient will say like, well, you said you ordered this an hour ago. Why hasn't it happened yet? But as an NP, well, by the time I put it in the system, a pharmacist checks it, the med gets to the bedside, the nurse sees the order. You kind of understand how the flow happens, or you understand what their access is like. Or if you see a pump constantly beeping, you know that there could be a problem with the pump, or it could be a problem with the patient, but you have to kind of assess that. Or there's all kinds of things. And same thing with like, psychosocial issues that patients have, or family dynamic issues. You see so much as a bedside nurse first that it really helps you when you're an NP. And we also have that, ability that we're in the nursing model, you're trained very much to really listen to your patient and do a lot of like active listening. There's like different ways they teach you how to like talk to a patient, so that your bedside manner as a nurse and then as an NP usually is also very good because you've had all that practice. So that's definitely something I would say is a big bonus too.
Yeah, great. Well, thank you. And thank you for your question, Michelle. And you guys did kind of already answer one of my next questions, which was talking about the benefits of seeing an NP. But before we get back into the questions, I just wanted to pause for a second and say, if you're just now joining us, thank you for tuning in. I'm joined by Shahzia Lakhani and Lauren Chapnick, who are 2 of our nurse practitioners at MedStar Georgetown Transplant Institute. And today we're discussing the role of a nurse practitioner and specifically how they help support our patients, our transplant patients here at MGTI. We've got a lot more to cover, so stick around. Give us a like to let us know you're watching. Share this broadcast with your friends, and if you have any questions for our experts, please leave them in the comments below. So my next question, which you guys are already answering all of my questions in one, but the next one was, how would my appointment be different if I see an NP?
Yeah, I can take that one. So, and Lauren is already working in the outpatient setting, so she can attest to it too. But I think it's very Nurse practitioners are pretty autonomous in that the surgeons rely on us to know the patient's case and care, to know their overall plan and next steps. And I think whoever you're going to see in the clinic is going to provide you holistic care. They're going to care about, what your situation is now, what you're going to require in the future, thinking ahead and making sure that you have all the resources you need, the medications you need. All of us can prescribe. All of us are able to make sure that you're set up for success, honestly. And we all have the best intention in your care, because we're going to continue to be a care partner for you. Lauren, do you want to talk about your specific outpatient experience?
Sure. So I'm actually currently in the intestinal transplant outpatient position role. So there is one NP who manages the entire post-transplant, either small bowel or intestinal transplant service. So it's really interesting because, like we were talking about before, I was inpatient like Shahzia, where, your patients that you see every day are the patients directly in front of you. And it's a completely different way to sort of assess the patient, because you're looking at them, you're seeing their daily issues, and you're planning for that time that they're in front of you. And so to transition then to the outpatient is really, very interesting, because some of these patients you haven't seen, in a very long time, and, they're calling you with like new issues or questions. So you do have to be really autonomous, and you have to really have a good way to like remember things about patients, have good rapport with patients and their PCPs, which was definitely like a new element for me, to try to see like what's going on with patients, or some patients, especially when they're freshly discharged, especially if they have like recurrent issues, you're seeing them very frequently. So you get to know them really well. You get to know like their families, their personal situations very well. You definitely work with all this, surgeons and the multidisciplinary teams a little bit differently, but we have like multidisciplinary clinics with like oncologists and us and radiologists, for example. So when we find like masses, it's a little bit of a different approach than when you're inpatient and you're calling a consult. But it's really great, and you do have like so much autonomy. Like I said, I see a lot of these patients just by myself, and then as the more complex the cases, the more the surgeons and maybe other medical providers like our GI medical team or oncology or hematology or other things really get involved. But it's really great, and the patients also really enjoy it. They tell me all the time, because they feel like they really get to know us, because we're the continuity. Same thing inpatient, right? You're the one seeing the patient every day. So they feel a really good sense of like connection and trust, which sometimes can be hard when you're, just making appointments somewhere, and every time you go in, you see somebody new. Here they have that benefit of knowing, oh, this provider knows me because they're the one that sees me every time.
Right. Yeah, that's always nice, and a nice, it's comforting to have that feeling happening when you're going through a transplant and anything really. And you already answered my next question once again, which was, do the NPs discuss patients' care with the doctors? And it sounds like, it's a lot of communication between the NPs and the different doctors. So moving on then. So once again, we talked a little bit about the benefits about seeing a nurse practitioner for healthcare concerns. Is there any other benefits that you didn't mention before that you would want to touch on now?
I think, Lauren, we talked about collaborative practice, right? We talked about physicians and continuity of care and ownership of the patient too, and responsibility to the patient. So I know in Lauren's practice, and I can see this as an outsider, that patients, when they get readmitted to me and I manage them inpatient, we communicate very closely. I tell Lauren, here's the update. I think that the patient will need follow-up for such and such. I've set it up. Or, they're going to go to the specialist first, and then they'll see you again in a week. Or they will need their staples removed, and, making sure that we have good open communication between the teams, and so that there is good continuity between inpatient and outpatient, but also just when, let's say a patient doesn't need to be readmitted for monitoring or management. Lauren is the go-to person, as she said, she's the one person. Our other teams, we have a kidney practice, a liver practice, and we also have a hepatobiliary practice. All of them have a very large patient population, and we do so many transplants here every year that we're able to make sure that we have a huge team of advanced practice providers and physicians who are managing the patient's care all the time. And so even if it's not a one go-to person, everyone has contributions to that patient and an ownership of that patient.
Mm-hmm.
Yeah. I was gonna say, one of the other benefits, I think this is sort of twofold. One benefit of being an NP and one benefit of seeing an NP is that as an NP, because you specialize in like a segment of a population, it gives you a lot of flexibility as to, what you want to do with your career. So, Shahzia and I both happen to love transplant, and we've been in transplant a very long time. But some people, they've taken this position and they've done neurology before, ortho before, or after transplant, we have friends who have, decided to move somewhere and they change their career and now they do infectious disease. So the other kind of neat thing is, one, as an NP, you are not sort of pigeonholed into doing just one thing.
Right.
You can kind of reinvent yourself and learn new things all the time and do lots of different things with your career, which also I think then really helps the patients, because again, like, you wind up getting all this extra sort of knowledge that doesn't just come from school. So like we were talking about, I started on the inpatient team with Shahzia, right? So our inpatient team does liver, small bowel, kidney, pancreas, hepatobiliary. And then I took over like straight hepatopancreatobiliary for a while. I covered hepatology when someone was out for maternity leave. And now I'm doing small bowel. So it really is super interesting. And, recently we had a patient where it really was so helpful, because when they were describing their symptoms, I noticed that this was not a bowel issue. This had to do with something else. And I knew exactly the right way to work it up, because I had all this extra experience from my other positions. So it was really kind of rewarding. And I also felt really good that I got that patient the right care as quickly as possible.
Yeah, great. Well, thank you. And my next question was, what made you both want to become nurse practitioners and more specifically work in transplant?
Shahzia, you want to take this one first?
Sure. I had a lot of exposure when I was young to the healthcare system with family care and people I knew needing to either be in the hospital or just typically as a child too, how I had an affinity for healthcare. And I initially, to be honest, wasn't sure if I wanted to be a physician or a nurse practitioner, but I knew that I wanted to be in healthcare. And I wanted to make an impact. And I had exposure to nursing. And even as a child, I just had a simple fracture, but the nurse made the biggest difference in my care and kept me in the loop. And I just had a great experience. And I had a nurse coming to my house as well. And so I had that different perspective too. And I said, wow, this is a really diverse career where you can have the same role in so many different places. And I got exposure in high school even more. We had a great program in our high school that exposed me more to it. And I think ultimately I knew I wanted to make an impact in a patient's care. And I thought that an advanced role as a nurse practitioner and having a higher degree would ultimately be best for me. So I'm very glad that I made this decision in this role because I can even take much further steps if I wanted to. I can work in healthcare. You can have a master's in to be a nurse practitioner or a doctorate or a PhD and do research. So I have many years ahead of me. Who knows where it'll take me based on, what experiences I have and what I can apply it to. But I think to your question about why transplant too, I, as a new grad nurse, 10 plus years ago. I had a couple options and a couple choices, and it was something that I had never thought of before, wasn't exposed to in school, and was able to gain a lot of clinical knowledge as a new grad nurse actually, at the bedside, taking care of patients, and the impact that transplant provides to give someone a new start, and such a gift that donors can give, and that anyone can give, to help change someone's life when they're in end stage organ disease is really rewarding, not only to the families of the donors, but also to the providers taking care of the patient, patients coming off dialysis, patients no longer having end stage liver disease or short gut syndrome, which Lauren sees all the time, or different cancers now that we have, exposure to this hepatobiliary program in our transplant institute, which is great. I think Lauren, if you want to go ahead.
Yeah, sure. So I also had experience to the medical world as a really, really young child. I had a lot of family members who were like nurses and things like that. And I was just like Shahzia. I was like, well, I don't know if I want to be a nurse, a doctor, a psychiatrist. And, I kind of followed some, people around, and ultimately I felt the same thing. The nursing model is very holistic, and it's caring, and it's more patient focused in terms of like being at the bedside for longer. And that's what I liked. And I also love teaching. So I kind of felt that I would get more of that ability as a nurse. So once I, did that, I was in the surgical ICU. And one of the things we did was take care of liver and kidney transplant patients. Mm-hmm. That's really when I got my first sort of look into that. And I absolutely fell in love with it. Transplant patients, when they first come out of the operating room and are in ICU, they're complex. They have lots of things going on, lots of lines, tubes, drains, and as a brand new nurse, I found it, one, exciting and terrifying, mm-hmm. But it was incredible to see these patients so sick, and, they have this organ, and, they're like it's like a very complex situation, managing all these different things to kind of help them get better. And then when you see them, like Shahzia said, a year later, they're unrecognizable. They have this new lease on life. They're working again. They're able to spend time with their family. They can go out. They would send us pictures of them on vacation. And I just thought, wow, this is something that's really complex and, really interesting from so many different levels. And as a human, just so many different ways illness and transplant affect your life. So I knew when I went back to be an NP that I wanted to do transplant. And so I did all my clinicals in different kinds of transplant. I did like bone marrow, liver, kidney. I tried a bunch of different things. I also did trauma. And, as I went through those clinicals, I really was like, yep, transplant is it for me. And I have to say, like, it's been so rewarding, just like Shahzia said. You get just, you're making a real difference in someone's life. And just to see these people grow and see the kind of lives they have, it's really humbling. Yeah. And I didn't even know, bowel transplant was even really an option. I heard about it at Mayo Clinic, but Mayo Clinic doesn't do them. So I was always sort of like, that's interesting, but I'll probably never see it. And then I wound up taking this position. And then I learned so much about it on the inpatient team, and I really fell in love with it. These patients are so complex. And like Shahzia said, you take someone who's really sick, who maybe has like short gut syndrome, they're living on IV nutrition, and they have tubes and drains and, wounds and all these things. And when they get this transplant and they have this new lease on life, it's incredible. I've seen amazing donor, lectures. I've seen amazing donor letters, donors saying, of course, it's incredibly sad what happens to their loved one, but they feel so good about giving someone a new lease on life. I've seen patients married, who we never thought would make it past a certain age. People have kids afterwards. It's really incredible. So transplant is just one of those rare things, I think, where truly every day you can say, yeah, we're definitely making a difference.
Yeah. I through doing these Facebook Lives, I've had the opportunity to talk to some donors and patients, and it is like just being an outsider and hearing them tell their stories. It is like incredible to hear. And so I can only imagine like actually being a part of that and, that journey like with them, and So that's incredible. That's great to hear. We have a question from one of our viewers. Michelle wants to know if you guys could tell us a little bit about your typical day as an NP. How many cases do you manage a day? A little bit, of your daily routine, if you will.
Shahzia and I have very different routines. So I think that'll be really interesting to hear. So now I'm on the outpatient side. So I guess I'll tell you that. And then Shahzia should tell you what her day is like on the inpatient team, because it's very different. So on the outpatient side, again, transplant is very, focused, right? It's not like when you go to your primary care doctor where they see sometimes like 60 patients in a day.
Right.
So my day, usually I come in, as an outpatient, I can get portal messages from patients. So like everybody here can have a patient portal, so they can like send me basically like secure emails. And then I also have, a phone call. So every morning I check my emails, I check my phone calls. I always have patients that I see in clinic. And a lot of times it's a balance between all those things, reviewing patients' labs that live far away. Patients can call me anytime with any question, issue. I get calls from other hospitals saying, hi, we have your patient here. We need to admit them. What do we do? What should we look for? So the days are pretty different. Certain days are procedure days also, where our patients after bowel transplant, they have to have what we call either ileoscopies or colonoscopies, which is a scope that goes through their ostomy and takes biopsies. So I have to follow up biopsies. I see the patients after those procedures, one, to make sure they're doing okay, two, to review all their labs, make any medication changes. So it's a super busy day, and it's not fully structured because every day is different depending on if I have 2 clinic patients, 6 clinic patients, if I have to admit anyone from clinic, because then, like Shahzia said, we have really great communication. I'll have to call the inpatient team, let them know the situation, call the ER, let them know the situation, talk to the attendings, make sure they know. And I always recommend to the inpatient team, like what I think is wrong and what tests should initially be done, because they might not know the patient as well as I do. So the day can sometimes really fly by. We also have, meetings that we do post-transplant, pre-transplant, where we talk about people's cases, where we kind of follow up, hey, this patient's been having this issue. Where are we now with this? And then like we also talked about multidisciplinary clinics, or sometimes I have to get on the phone with, one of the other specialists and say, hey, how do I best manage this patient's, iron deficiency anemia. They're not absorbing the iron. Maybe we should set them up for IV infusions, and I'll talk to hematology about that. So my day is pretty different every day, but it's really rewarding. And almost every single day I do see patients in person. So really only one day a week we kind of hold as our administrative day, where it's really supposed to be focused on reviewing the labs, getting back to patients with their messages, their phone calls. And obviously if there's any, emergency cases, I will see them that day as well. So yeah, it's really great because it's different all the time.
Yeah. And then Shahzia, did you want to talk about the inpatient side of things?
Yeah, so our day starts really early. We get signed out for our night team, so we know what events occurred for that for our patients, and we split up our list typically by organ system and focus on that organ system per day. So for example, if I am on the liver team tomorrow morning, I will come in, round on those patients independently, make sure that patient did okay, and kind of develop a plan of care with that patient. Look up their labs that they had drawn in the morning, review their diagnostic imaging, order further diagnostic imaging if needed, like CTs or x-rays, depending on what their condition is. And beyond that, the rest of the day is very collaborative. So we meet together to then round with our entire team, and then we talk about how to kind of navigate the rest of the care for their stay and make sure that they can be successful at home. So we meet with a social worker, case manager, and everyone together so that we can develop a plan and involve their family as well. And if that patient is if one of, I would say our caseloads are pretty high on the inpatient side, about probably, I would say 8 to 10 patients a day, of which are pretty ill. We can ensure that they are set up for success for discharge, and the entire day can be a little bit different every single day, depending on a patient's condition and how they progress in a good or bad way, and kind of support them through the entire day. You also will have like nurse practitioners and PAs work 24/7. So we have a 24/7 model on the inpatient side for coverage. We also have residents training to be full-fledged independent physicians one day. So they are also involved in your care, and we partner up so that we can make sure that the lists are divided and everyone is accounted for 24/7 to make sure, you know, we have day shift, night shift coverage, and patients who come in for the operating room too. Our advanced practice provider team gets together to pre-op the patient and then get them ready for surgery, especially if they get a organ offer and they're coming in to get a new transplant.
Great, thank you. It sounds like you both have busy days where you're constantly on your toes, and that's great to hear. And thank you for your question, Michelle. So we've covered a lot today, a lot of good stuff. My last question for you both is, what message would you like our viewers to take away after watching this broadcast? Lauren, if you wanted to start.
I think the biggest thing to take away is that an NP as a career is a wonderful opportunity to, you know, really take all your medical knowledge, provide holistic care for patients, and that you can do so many things within that career. And I think as a patient, to know that your NP is well-rounded, they're gonna, you know, give you holistic, coordinated care. They work really closely with everybody in our system, like we were talking about before, and that, you know, ultimately, we're all here to work as a team to take the best care for the patient.
Great. Shahzia?
Perfect answer, Lauren. Our approach and our experience providing holistic care and doing what's best for the patient is what's on our forefront all the time.
Yeah. Thank you. Yeah, it's always hard being the last person to answer that question, because it's always like, oh, what she said, what he said. But so that wraps up our broadcast. Thank you both for joining us today. We really appreciate it. And thank you to our viewers for tuning in and asking your questions. We hope you're leaving this broadcast with a much better understanding of nurse practitioners and all they do for our patients. If you would like to learn or get more information about MedStar Georgetown Transplant Institute, please call 202-444-3700. Thanks again, and we'll see you next time.
Thank you.
Thank you.